This episode of Spotlight Hawaii is brought to you by Chaminade University.
Good morning, and thanks so much for tuning in. Great to see so many of you already logging in this morning as we begin another week together. I'm Ryan Kalesuji, joined by Yenji Denise, and this is Spotlight Hawaii. And we know, Yenji, as we begin this week, there's still a lot of questions out there about how the state is responding, of course, to COVID-19. And this morning, we're in straight to the source.
That's right. We are joined live from the Hawaii State Capitol, that is, by Governor David Ige. Governor, thank you so much for joining us this morning. We do appreciate your time.
Thanks, Yanji and Ryan. Thank you again for giving me this opportunity.
I want to start with the vaccine mandates that you've outlined for state and county workers. You know, throughout this program, you've been gracious enough to join us on a regular basis, and we've talked about vaccine mandates for many months. You and the county mayors really resisted that call for some time. What changed your mind, and did you have to do a lot of convincing of the county mayors to join you in that call?
You know, Yanji, I think that the Delta variant is really a game changer. The fact that it is so much easier to transmit, and definitely the fact that even we are seeing a few breakthrough cases in those who are vaccinated, it changes the dynamic. The other thing that we saw happening was that the pace of vaccinations really fell off. You know, in May, we were vaccinating 70,000 a week on average. In June, it fell to 36,000 per week on average. In July, it fell further to about 15,000. And then it fell to less than 8,000 per week after that. So we saw a significant drop off in the vaccine, those choosing to get vaccinated. So it was clear that many who were not vaccinated would not be pursuing vaccination, and we had to do something.
You know, we know that there has been some pushback by groups out there who do not believe that there should be any sort of vaccination mandate. There were some demonstrations that were happening over the weekend in front of the Hawaii State Capitol. What is your response to those individuals who believe that this should not be mandated, and your response overall to those workers who may still resist this, even though the state, your orders will require these state and county workers to get this vaccination?
You know, Ryan, it is one of those issues that it's really balancing the individual interests of people against the broader community interest. And especially when it comes to public health, we always put the overwhelming public health as a concern. We do know that COVID has ravaged the entire planet. It's an infectious disease, and millions of people have contracted the disease and died. And so we do believe that vaccinations are the answer. We have vaccinated hundreds of millions of people here in the United States. The adverse reactions have been very, very minimal. And we do believe in order to protect the health of our community, that requiring vaccinations of state and county employees is the right thing to do.
Let's talk a little bit about those exemptions. We know that you are allowing for religious and medical exemptions. Medical exemption seems fairly straightforward. You would need to get verification from a healthcare provider, but the religious exemption, it doesn't seem very clear, at least not to me. How do you verify a valid religious exemption, and how does one go about claiming that?
You know, we will be looking at, and actually we're working through the details of what would be involved with that. You know, there are few instances of us requiring vaccinations right now. We do have records. We do mandate vaccines of children as well as adults from a public health perspective right now. So we have some information and data that might be available to help us recognize that. You know, for example, students currently in the public schools or in schools all across the state can claim a religious exemption to be excluded from the vaccination requirement. So if someone suddenly claims that they don't want to take a vaccine because of religious reasons, and we don't have a previous record of them claiming an exemption for vaccinations, that's one thing that we can verify and begin to question.
As we look at these numbers over the past few days, including what is being reported today, yet another day with 400 plus cases, what is your thoughts on imposing any sort of restrictions again? We know, of course, that you did announce these vaccination mandates for state and county workers, but is there anything more coming that you're thinking of implementing once again because of these recent numbers?
Ryan, we are having to look at restrictions again. We were hoping that the case counts would level off and begin to normalize, but we are seeing exponential growth. As you know, on July 3rd, there were 60 cases, and over the last few days, we've averaged more than 600. So clearly, we're not going in the right direction, and we need to take further action to restrict interactions. I think we all understand how this disease is transmitted, and many of us have done all the things that we've asked. Wear your mask, maintain physical distance. All of those things work and have kept our community healthy. We are seeing this Delta variant is very different. It's significantly more virus that it carries for those who get infected, and it gets spread quicker to other people. And so we are going to have to do something. Our hospitals are filling up, and that's the concern. And we're 2,500 miles away from any kind of help. So, we've implemented a surge capacity in virtually every hospital around the state. We're working to bring more workers to help deal with the increasing case counts. And all of those things, is necessary to keep our community safe. I do think we need to look at restrictions in order to stop the spread or slow the spread of the virus in the community.
Following up on that, Chase is asking, what restrictions will we bring back? What specifically do you have? We know that the counties, for instance, had the tier system. Mayor Blangiardi has been clear that that's not something that he wants to re-implement. He doesn't want to put restrictions on businesses. What specific tools do you have? For instance, safe travels, let's look at that. Do you anticipate mandating testing again for those who are coming into the state?
Yeah, so Yanji, we are seeing clusters all around the state in the areas that we've talked about. It's really gatherings that spread the virus. So private gatherings in homes. So a reduction in the number of people who can gather both indoors and outdoors is definitely one area that we're looking at. And we're trying to make sure. We want to be smart about how we can be focused on the behavior that is spreading the virus, the behavior that's more risky, and that we're seeing more cases in. And that's what we're looking at doing. It won't be as broad a restriction as we've implemented in the past, but it's clear that the cases keep growing. And that will overwhelm our healthcare system if we don't take further action.
Do you believe that the vaccination verification process that is being used, of course, for safe travels for guests and returning residents coming back into the state, as well as some businesses are now using that verification process to get into a larger event? Do you think that that is helping? Do you think that is working right now, given these numbers? Do you still believe in this vaccine verification in order to enjoy attractions or events or to come into the state?
So a couple of things with that, Ryan. We do know that Delta is different. Talking to Dr. Charles, she says that someone infected with Delta variant carries 1,000 times more virus when they're sick, and that's really a concern. And we are seeing a few breakthrough cases where people who have been vaccinated fully are contracting the Delta variant, and that's definitely a concern. I would note that the vaccine is still effective. That those who have been vaccinated have very mild cases of COVID, And that kind of works both ways. Sometimes they don't believe that they're infected with COVID because the case is mild. It's more akin to the flu. They have sniffles, maybe some congestion, but it doesn't sound like COVID, and they continue to work. So we need to get people to recognize as soon as they get any COVID symptom, they really need to isolate, wear a mask, and hopefully get tested. As far as safe travels goes, Ryan, we haven't seen a significant number of cases tied to visitors traveling to the islands. Most of the instances of COVID cases that we've been able to contact trace are coming from residents who've traveled, gotten infected, and brought the virus back. And so we are not looking at changes to safe travels right now. We do know that might be something we need to implement if we can't get the numbers to level off and to really start trending downwards. Yanji, you're muted.
At least once a show. To that end, Mel Raposo has a question. I have to take him at his word here on this figure because I don't have a way to verify it in the moment. But he says, Kauai has 54% travel-related cases. Can the governor comment on this, please? I'm assuming that a vast majority of those, based on what we've learned on this program from Dr. Char and others, are the ones that you're talking about, people who are returning residents who then spread it among their friends and family. But if we had that testing verification on the mainland as we did before they returned, then presumably some of those cases would be caught on the mainland. They can be treated. They can stop the spread, in place, if you will. So why not bring back that mandatory 72-hour testing? Because we know that, there are returning residents who are bringing back COVID.
Yeah, certainly, Yanji. We are looking at that. We also are seeing more instances where people are trying to fake the vaccine record and other activity like that. So, we're cognizant. We're looking at what data we have. We still believe that the bulk of the travel-related cases, as Mel had reported, and you got to remember, right, that Kauai has always had the lowest number of cases in any county. And even though there's been an increase on all islands, the increase for Kauai is relatively small. So I wouldn't be surprised. And my guess is most of that 54% of the cases are residents returning to the islands rather than visitors. And so we definitely are talking about it.
One of the things that people are also calling for is just more access to test availability. We know that this was a big part of the plan overall during the beginning of the pandemic, and that testing sites were often replaced with vaccination sites through this vaccination process. Is there any plan to bring back more of these testing sites now that also testing is an option for those who choose not to get that vaccine mandate for these workers in this county and state offices? But is there plans to bring back more testing availability given the numbers that we're seeing?
Yes, Ryan, we are making more testing sites available. As you know, when the case counts dropped, testing didn't seem as important as it may have been a year ago. But with this latest surge, we know that we need to do more testing. The challenge is that many of the people who are involved with testing are also the people involved with the vaccinations. And, we reallocated people to focus on vaccinations. We are doing a better job now of balancing, as you know, the vaccination rate has kind of dropped off, and we're trying to get that equilibrium where all of these sites will be available for both testing as well as vaccinations. And yes, the state is contracting with providers so that we can make testing more widespread and available as we move forward.
I want to ask you about people who have had COVID. There are people who have contracted the virus, overcome it, and say that they have natural immunity, so perhaps they don't need the vaccine. Does having had the virus, and I don't know if there's a way to verify that, but if someone has experienced COVID-19, can they be exempt from the mandate of having to get the shot if they're a state or county worker?
Yeah, no, they won't be able to get exempt just because they had COVID. We recognize that that individuals who had COVID will develop a natural immunity. We also know that the vaccine really enhances immunity way beyond just the natural immunity that people would acquire. So, we do believe from a public health perspective that we want all employees to be vaccinated, even those that contracted COVID and have recovered.
Given the cases that we're seeing and these high numbers, there were a lot of people here asking about some of the specific clusters, about what we're doing to stop it in certain areas in our community. And that brings up the question of contact tracing. We know that this was an issue early on, again, during the pandemic. The state made resources available to add more contact tracers to the Department of Health team. But given the numbers that we're seeing right now, how difficult is it for these contact tracers to continue to keep up with these growing number of positive cases? And is this at a point where that team is fully staffed, and are they able to execute the contact tracing mechanisms needed with the given counts right now?
Yes, Ryan, the case counts, especially in the last week, 10 days, have really exceeded what we've seen in the past. And we have more than 260 contact tracers still on contract or working for the state. We are adding, especially with this last surge that we saw as the case counts increase. We are bringing back additional contact tracers. But the sheer number of those involved means that it'll be more difficult to get to every single case. We continue to set the goal that we want to talk with everyone who is a positive case and trying to understand where they might have gotten infected. But it is a challenge. Just the sheer number of cases makes it very difficult to do. One of the things that we are doing is really helping businesses and organizations help themselves. Just talk to them about, what contact tracing is, ensure that they capture data about interactions within the workplace so that should someone become positive, they're aware of who they may have interacted with and who they may have infected. And that really has been helpful, just trying to make sure that everyone understands that they can be part of contact tracing, that the more information they can provide to the Department of Health, the better we can identify clusters and the better we can isolate people who may have been exposed and get them tested.
Given that students are now required to be vaccinated to participate in sports, are you planning on any moves to make this mandatory for attending school, period?
Yanji, there is a current process that we go through in determining which vaccinations will get mandated, and so that will happen. There is a panel of experts that look at the data and look at the public health risk and make a determination about whether we are going to mandate the vaccines or not. So that process will continue, and they will make a determination about whether a COVID-19 vaccine will become mandatory. That's a little down the ways right now. The decision to require athletics to be vaccinated was just looking at the risk. In many instances, children will be interacting in a much more intense kind of way. It's difficult to participate with masks on, and the department just felt that they wanted the benefits of organized sports and athletics, but the best way to mitigate the risk to students and each other, the participants, would be to mandate the vaccinations.
We know that you have set this benchmark for the state of 70% vaccination, and right now we are just at about a little over 60%. Given where we're at now, the number in cases that we're seeing, do you still hold true with that 70% benchmark, that if the state does reach that we would lift all restrictions, or are you considering any changes to that benchmark given the number in the cases that we're seeing now with the Delta variant and its presence here in Hawaii? Could that 70% increase, or could that 70% still be in place, but maybe not loosening up all the restrictions? What is your thought process on that benchmark that you initially set?
Yeah, Ryan, we definitely know, and speaking with the public health experts and the epidemiologists, that Delta changes the dynamics. And clearly 70% is not the same 70% that we talked about even 2 months ago or 3 months ago. So we're going to have to assess the conditions. You know, Ryan, I checked the reports this morning. We have more than 200 patients with COVID in our hospitals all across the state. That number was less than 40 a month ago. And that's the biggest concern, you know. We definitely will be reevaluating 70%. I did check the vaccination data this morning, and we're up at 68.3% that initiated and took the first dose. And, you know, we had our first 10,000 vaccination day in probably almost a month. So clearly people are responding to this surge. More people are getting vaccinated. I think that we have a better shot at hitting the 70%, but I do believe that 70% won't be good enough. You know, we'll have to watch the case counts, how many sick are in our hospitals, and what our capacity of the hospitals are to handle those who are infected.
How soon can we expect a change to the gathering size? Because it's something that, you know, you referenced last week, you referenced this morning on the show. I would assume that is coming pretty soon. When can we expect more news about that?
Yeah, certainly, Yanji. I'll make an announcement before the end of the week. You know, we are kind of working through the details and thinking about how to structure it so that we can get to the behavior that is most fueling this latest surge without impacting all the businesses all across the state, or at least trying to minimize the impact.
You know, one of the things that we are seeing when we hear these statistics that are released are also statistics regarding those who have contracted the virus that have been vaccinated and those who were unvaccinated. And a large majority of those who are conflicting or getting COVID-19 are those who are unvaccinated. But as you said earlier, there are still a few of those breakthrough cases. However, it's difficult to track those cases of those individuals who have been vaccinated and were contracted with COVID-19. Would you consider any order that would require people to state when getting tested if they've been vaccinated or not at the time of testing, rather than at the time of when they receive the results? Because at that point, it's a little late. And as you mentioned, the contact tracers are having to catch up with a number of cases. Is that something that could help to determine the, I guess, a more comprehensive number of those who have been vaccinated and still contracting the virus?
Yeah, Brian, I've heard that suggestion, and that might be something that would be helpful. So we're talking with the department and the providers to see how easy it would be to capture that information at the point of testing. You know, I think that that's a good suggestion, and something I think that would add value to the community. And I think it would be relatively easy to implement. So certainly something we'll explore.
Stephanie has a question here. Do you stand behind the decision to send Keiki back to in-person learning this week, especially considering that kids under 12 are not eligible for vaccine? We saw just last week with the start of school, over 100 cases reported in various complexes throughout the state. How are you feeling about kids being back in school right now?
Thanks, Yunji. You know, we do believe that that COVID has really impacted our young people the most. And we are getting more and more reports about the mental health effects of not being in school, of not having the social interaction. that is so much a part of social development and school development. So we in looking and balancing the risks, we do believe that having 180,000 students statewide in virtual learning again, and the challenge is about when would we get back to in-person learning. I think we're doing a much better job of being able to identify students, staff, who are sick and make sure we can isolate and test them very quickly. And I do believe that the benefits of students being back in school, and it's more than just the learning and the social development that's so important, especially to our young children. But it's about getting people back to work because they don't have to pay for childcare anymore, and really getting back to normal. So, I have heard the numbers of cases that has occurred in the school setting. In most instances, they were people showing up on campus who were sick and were identified and tested. And we do believe that the layered approach will allow us to keep our community healthy and safe, and that the students benefit. I talk with teachers and students, and they are so happy to be back to school, to see their friends, to be able to interact like they used to. Even though they might all be wearing masks, the socialization is just such an important part of the learning.
We continue to see a lot of comments here regarding tourists and those who are entering our state. Many are still upset with the high volume of numbers of visitors that we are receiving here to the islands, given the state that we're in with the pandemic. What is your response again to those individuals who are calling for maybe a pause on tourism, for things to settle down at this point in time, given these case count numbers and the tension that seems to be growing between the increase of visitors and local residents?
Ryan, we are very cognizant of the number of visitors coming in, and we are looking and talking with the industry about managing that situation. As I had stated, the actual number of cases that are the result of visitors coming to the islands is relatively small, but we do know that any amount of visitors, especially as the cases are spiking, is certainly a concern of ours and concern of the community. So we will be looking at safe travels and thinking about changes that make sense. As you had mentioned, reinstituting the testing program might be something that we would consider. We also recognize that it's getting people back to work, and our unemployment rates have dropped tremendously as the number of visitors have increased, and we are committed to trying to get everyone back to work. We know that it's important. It's an important part of strengthening our communities and getting back to normal.
I know our time is almost up, but I want to ask you this question. I asked the city and county of Honolulu this morning for some vaccination numbers, and these might not be current because obviously people are getting vaccinated as we speak, but so far they say HPD has 75% vaccinated, EMS is 78%, HFD is 78%, ocean safety is among the lowest, below 70%. I'm curious to know, for those workers at that level, we need those first responders. We know HPD has a officer shortage well before the pandemic, and that it continues. Are you concerned that we could be losing some of these first responders who either decide to take early retirement or just decide to quit because they don't want to do these vaccinations, and the impact that that could have on our community?
Certainly, Yunji, the shortage of first responders has been a chronic issue, and I've spoken to the chiefs on all the counties about how we can do a better job of recruiting and being able to staff both police and fire. And so any loss of employees, first responders, is definitely a concern that we all have. But my experience in just talking with police and fire is that they are public servants first and foremost, and this vaccine requirement is really about trying to keep the employees safe as well as improve the health and safety of our community. And although I would hate to lose even a single first responder due to the vaccination requirement, I do think that the benefits of employees being vaccinated, both for their public health as well as the community's public health, is a risk that we have to take.
As we close things out here, I wanted to just get one final question in, and a lot of this is in response to the comments that we're seeing. There just seems to be a tension and just a growing divide in our community between those who are advocating for the vaccination, others who are opposed to it, opposed to mandates. With so much conflicting, thoughts and strong opinions here in our community, how do we bring this conversation to something that is one that can bring people together? You are the governor of the state. You represent all of the people of Hawaii, and yet there seems to be so much division right now in our communities. What would be your final message to everyone here this morning as we deal with a very serious disease, but two very different thoughts on how we handle this?
Yeah, Ryan, that's something I think that I and the mayor struggle with every day. It's we do appreciate the notion that everyone has individual rights and should be able to exercise them as appropriate. At the same time, I'm proud to be governor of the state of Hawaii because the overwhelming majority in our community get it, that in this island community, what I do impacts my friends and my neighbors in virtually everything that happens. And the overwhelming majority of people are willing to sacrifice their individual rights in order to protect the health and safety of our community. I appreciate and I hear the concerns that those who disagree with my policies. I do try and listen and be aware of the concerns that they have. Many are reluctant and cite very poor misinformation or facts that have been proven to not be accurate or appropriate. And so, I think it's a balance. I wish that there was a way to get away from the misinformation that is shared. Social media is a blessing and a curse in the sense that everyone has a global platform and everyone is free to share their thoughts with anyone else on the planet. And that really does encourage confrontation and conflict. I think programs like you and Yanji host is just an important part of trying to bring our community together. I've spoken personally with many who have raised concerns. I do hear the protesters around the state and really do listen to see if there is a way to try and arrive at a more reasonable conclusion. We are providing exemptions on a limited basis for those who don't want to get vaccinated, but we do believe that that it's in our community's best interest that everyone get vaccinated.
Okay, Governor David Ige, starting the week off with us from the state capitol. We do appreciate your time. Aloha.
Aloha.
Mahalo. Thank you, Governor.
Well, good to talk to the governor. We see all your comments. We see hundreds of you who are watching live. We encourage you to share this video so that you get sort of an insight into what the governor is thinking and his thought process there. As we started out the show asking him about what changed his mind, because for months he had said that, that mandatory vaccinations was not something that he wanted to do. And the county mayors echo that sentiment. But he says that Delta is simply a different animal and that they really feel like they have to do something to stop the spread. And this is the something that they're looking at. And Ryan, he also said that they are looking at gathering sizes and possible changes to safe travels.
Yeah, everything really on the table at this point in time, given the numbers. And the governor says that we can expect an announcement sometime this week as they continue to meet with the mayors as well as other state leaders and Department of Health officials to determine what that mandate would look like, what those restrictions would also look like, and how that would apply to not only the county, but the overall state. And if that will, in fact, impact visitors also coming to the islands. He did say, however, that he is trying to find a way to minimize the impact that this will have to businesses and organizations, because he recognizes the hurt that so many have gone through early on during this pandemic, and recognizes that further restrictions could once again hurt these establishments. So a tough job to try to balance all of that and figure out how to bring these numbers down and reimpose some of these restrictions once again.
Yeah, and we got a little bit more clarity also on exemptions. He said that having had COVID-19 does not mean that you are exempt if you're a state or county worker from getting the vaccination. That does not count, even though you may have some natural immunity. He says that public health officials say that it is not as strong as getting an actual vaccination. So that doesn't sort of exempt you. And the other thing that he talked about was the whole religious exemption, that suddenly having a religious exemption when you've never had one in the past might be a red flag. So they're trying to figure out exactly what those protocols are, and how someone might be able to claim an exemption, and how the state on the other side may be able to verify that. So that sounds like it's still really being worked out.
And the other thing that could also change is the 70% vaccination benchmark that the state has been marching towards ever since this rollout began. The governor saying that Delta has created a much different dynamic once again, and that things will have to be revisited, including that benchmark of 70%. Given that the numbers that we see, we may get to a point where 70% may not still be enough, and that they may have to increase that even more. So they will continue to monitor the case counts and see how things are moving forward, if they are going to change and move the goalpost, so to speak, to something that is even higher than that 70% threshold that the governor and the team had initially set out.
We see a lot of you writing in about schools, a lot of parents who are concerned on both sides. We are going to have Interim Superintendent Keith Hayashi on this program on Friday for you to ask all of your questions. Of course, he takes the helm over from Dr. Christina Kishimoto at a particularly critical time. We're going to be asking him about, the cases that they've seen on campus, the protocols that they're using, and also, that decision to require student athletes to get vaccinated. And if we could see, the full student body being required, those who are eligible to get those vaccines. So we're going to be talking to him on Friday. On Wednesday, Ryan, we're going to be speaking with prosecutor Steve Alm, a lot to speak with him about as well.
Yeah, including some of the more notable cases that have come up recently here in the city and county of Honolulu, as well as the enforcement of some of these COVID restrictions, what they're dealing with, and the backlog that the court system is seeing with all those that have gotten delayed because of COVID-19, how they are going through that backlog, and some of the other processes that are being dealt with at the prosecutor's office. All of that coming up this week. We thank all of you for being involved in this conversation. Again, a lot of comments. We thank you for being involved and being a part of this conversation. We try to summarize your comments as best as we can, because we know we can't obviously bring in all 150 comments into the show, but we try our best to include those topics that are important to you. We thank you for watching, and we'll see you right back here on Wednesday. Aloha.
Mahalo.
Spotlighting Hawaii's. This episode of Spotlight Hawaii was brought to you by Chaminade University.